So for healthcare providers, step one for helping your clients cope with loss and grief starts with yourself. Acknowledging, recognizing grief within your own life is invaluable. I know this from experience, having lost a parent just before starting my training in clinical psychology. I very quickly realized that until I was able to work through my own grief, I wouldn't be able to hold the space for someone else. And this idea of being present and holding space is something that we have heard throughout this conference. I'm going to get to in a moment. But unresolved grief within the healthcare provider takes up space in our minds and hearts that prevents us from holding the space for other people. So really working through your own grief is step one, if that's applicable. I would say that one of the most common things I hear from other healthcare providers about what makes talking about loss and grief so challenging is that it's a difficult conversation, and a lot of providers just don't know what to say. You're hearing something very potentially difficult, challenging, maybe one of the most dark periods in somebody's life, and that can be really difficult to know how to respond to. And so I implore every healthcare provider here to ask and acknowledge that grief might be an important part of somebody's experience with chronic pain. If you don't know, or if you don't ask the question, we won't be able to provide the comfort. I'm trying to remember the quote properly, but Leonard had just talked about that we first need to understand what is being comforted before we can comfort that person. So we do that by asking. So if you don't know what to say to someone, you can say that. I don't know what to say. And you can just validate and reflect back to the person. You know, I hear that you've experienced profound loss. And just listening, reflecting, sometimes not saying anything at all, and just leaning into the person, making eye contact, being present, sometimes taking a deep breath. Right now, I don't think you can see it, but I've got my hand to my heart. I'm leaning forward and just active listening, showing the person that you are there for them. You're not trying to provide any corrective feedback. You're not trying to provide any advice. Is so powerful. We heard Lori talk about that just now. Just somebody to be beside you, somebody to support you, not trying to give you advice on what to do can be so powerful. And of course, allowing the client to tell their story without interruption, without inserting your advice, without inserting your own experiences with loss and grief, and so on. And so this holding space idea is something I've heard throughout the conference. Dr. Sam Parmiter, who is a pharmacist who was talking about opioids yesterday, he talked about the importance of listening to the client's story, holding space. Dr. Yo, who is an anesthesiologist working in the transitional pain program, talked about being present, person-centered care, holding space. Lori talked about that just now in this morning's presentation. Around the medicine wheel, we talked about the importance of the relationship and holding space and being present for your client. So this is a theme that hopefully people are seeing again and again.